Thank you again for everyone joining us. I'm going to give it just a few more minutes um, before we have Matt talk, just to make sure that everyone is in. We have about 2 minutes before Matt will take over, and then we'll let him start. Just about 1 minute, Matt.
Zach, could you give the link one more time, please?
Yes. So the link for resources is www.nhscares.org/faith resources. There will be a few more links that we'll share with you today. One is going to be how you can request some of these resources mailed to you. We have funding from the Commonwealth Prevention Alliance to print and be able to mail these resources out. So you'll be able to request, basically put an order in for these resources, and we'll print them and have them shared out via mail to you all. All right. I'm going to go ahead and say that it is a perfect time for Matt to step in and start sharing with you all. I'm so thankful for Matt's partnership in, not just in my local coalition, New Hope Soulbury Cares, but countywide. Some of you may know that I both work at New Hope Soulbury Cares and I work in Morrisville for First Baptist Church of Morrisville, and I work running the Solid Rock Youth Center in Morrisville. So I wear a lot of hats, and in every one of those capacities, I'm thankful and grateful for Matt's partnership. He's a partner to faith leaders, and he's a partner to preventionists. So without further ado, I'll turn it over to Matt. If you are ready, Matt, you can take the lead and share with us a little bit about your take on the county addiction problem.
All right. Thank you, Zachary. I appreciate it. This is, I guess, the new normal. We got to get used to these Zoom meetings, although I do miss seeing all of you in person. I of course, think that that's a great way to have contact, but this also is a great way because you don't have to leave, your house. Some of the news that we have, I always try to present an upbeat and a positive picture, but some of the news that I have to report, unfortunately, is negative. And I think that it is directly related to COVID. And what we've seen is an increase in fatal and non-fatal overdoses. And that can be attributed to a number of factors. And these are anecdotal, but what I've been hearing is that that's due to people being shut in the house, people not having access to the normal services that they would have access to because of that lack of ability to have personal contact. And also, frankly, depression. There's a lot of mental health and co-occurring issues that have caused our overdoses to start spiking back up. We were on an amazing trajectory, and I hope to get back there. We were on an amazing trajectory as our overdoses, fatal and non-fatal, were going down. And I think that's in large part because of the next speaker that you're going to hear from, Diane Rosati, and her organization, and organizations like all the ones that Zachary is involved in. And frankly, because of community awareness, that's really where it starts. We have to come together as a community to make sure that the people that are most in need of help have access, know that they're not alone, destigmatize a lot of the issues that surround drug and alcohol use disorder. We've also seen, unfortunately, according to the PACE survey, and Zachary and Diane were a part of the last Zoom meeting that I was on related to the PACE survey, which is a survey that's done of our youth in our county, that says that alcohol use has increased, not only in our youth, but in all ages. And I attribute that once again to this pandemic that we're faced with. And I promise you I will have some positive things to report, but I want also to let you know the lay of the land out there, as that's been my responsibility. And we're not only seeing heroin and opioid abuse, but we're seeing the rise of methamphetamine or speed or crank, whatever you want to call it, on the street. Some people will use that as a way to cut the withdrawal symptoms from heroin or opioids. Other people will use it because, candidly, because they enjoy the feeling that it gives them, and it is quite cheap. So these are some of the negatives that we're seeing, the trends that we're seeing across the county. But now I want to dive into some of the positives, and the framework that I like to use. I have 5 goals for somebody that may intersect with the criminal justice system that has some substance use disorder. My first goal always is to keep them alive. If you can't keep them alive, you can't help them. You can't treat them. You can't reintegrate them. You frankly, can't do anything. So one of the things that I'm most proud of is our county's use and acceptance of Narcan. I don't know if you can see this little atomizer I have here in I see Monsignor nodding his head, so I'll take it that you guys can see me. Thank you, Monsignor. This little guy right here packs a powerful punch. It's a lifesaver. And one of our goals, this was quite a few years ago now, so that it's been normalized, was to put this in the hands of every first responding police officer in the county. And we were successful. That was quite a campaign. Diane joined me in that, and some we had to do through sheer force of will. But for the most part, we were an early adopting county. So every single one of our first responding police officers now carries Narcan. All of our school districts now have Narcan. If you say heroin and opioids kill, Narcan saves. It's a lifesaver. And frankly, people all across the community ask me, what can they do? Well, if you know somebody that's at risk, or you're in an area where there are people at risk, carry Narcan. It's free. You don't need a prescription. Go to Drug and Alcohol Commission right here in Doylestown and you can get it. They'll train you on it. And this is really quite simply how it works. You take this atomizer, if you feel that somebody's overdosing, you put it up their nose, you just save somebody's life. It's that simple. And if they're overdosing on something else, or we had one instance where a guy was just sleeping, but he looked like he was overdosing, and they tried to save him with Narcan, it has no negative effects. So you can only save somebody with this. You can't hurt them. And obviously, of course, we want you to call 911. But to give you proof positive that these kind of programs work, these community-based programs work, since we gave these to police universally in Bucks County, we've saved well over, the police, first responding police have saved well over 1,000 lives. I think it's somewhere between 11 and 1,200 lives as first responders. So that's number one, keep them alive. Next is get them treatment and prevent them from their substance use disorder from reoccurring. How do we do that? Well, I'm very proud to tell you that we have, it was a pilot program in Bensalem, which was called Bensalem Police Assisting in Recovery. Now it's Bucks Police Assisting in Recovery. I think we have upwards of 19 police departments that either have employed this already or in the process of employing it. And that's half of our police departments all across the county, Upper Bucks, Central and Lower. And the essence of it is that if you have an issue with substance use disorder, you can voluntarily go to your local police department and say, I need help. And rather than looking to lock you up, the police will then start a progression where a navigator will come and help you get the treatment that you need. I have to caution you by saying if you have an active warrant or if the police are arresting you for something else, you can't just say, hey, I want BPAIR, but you can voluntarily turn yourselves in. A person can turn themselves in and get the help they need. So this is a treatment-based philosophy that our police are actively engaged in. I'm very, very proud of them. Another thing here that we in Bucks County do better than anyone, which I love, and people are always asking me, how can I participate? What can I do to stem the tide here? Well, what you can do is take your old, expired, unused medications out of your medicine cabinets, out of your pocketbooks, out of your glove compartments, off your counters, and get rid of them. You don't flush them in the toilet. You don't throw them in the trash. You take them to one of our medication collection locations. And we have, I think it's between 40 and 50 permanent ones. That's 5 out of the 6 hospitals. They have a medication take-back box at almost every one of our police departments has one. Both courthouses have them, and people get it. They used to wait till our semi-annual collection dates to dispose of their old, expired, unwanted medications. They don't wait anymore because they know that if that medication is there and they don't need it, they got 30 Percocets and they took one which frankly is an overprescription in many instances, you can't leave it in your medicine cabinet, because somebody that has that craving, that can't help themselves, is not going to be able to resist. They're going to find that in some way and divert it so that it may be able to hurt or kill somebody. So what do? You take that old expired unused medication, and I want you all to preach this to your flocks. And you take it and you make that permanent one-way deposit. And then what we do in law enforcement, we take all that medication from those secure locations and we incinerate it. And to date, and I don't have the up-to-date number, but I am proud to say that we here in Bucks County have collected over 150,000 pounds of old, expired, unused medication. This past medication drop-off day that we just had a couple weeks ago, we broke our own record. It was a drive up and drop off. We are undeterred by this pandemic. We broke our own record with 14,000 pounds. And a lot of that also has to do with awareness, but you can turn in your kids' vapes and your unused pet medications as well. And you don't take it out of the packaging, we take the packaging. So that's something that not only can we all do, but we all do so that we are #1 in the state. Monco's catching up. I saw a couple of you from Monco on this call. I don't want to give you any ideas, but we're going to stay #1. I hope you guys remain #2. That's fine. The third thing, and this is where you all come in, is if a person has been kept alive, they're getting treatment or prevention, we need to reintegrate them. We need them to get back to their old healthy lives with their families, with their work, with their churches. We need mentors. We need faith-based support. And this is part of my pitch. Please, if you're listening on this Zoom call, join the faith-based steering committee. I can tell you pre-pandemic and God willing post-pandemic, I expect to be doing this. Anytime I ever did a faith-based discussion like this in a church or a synagogue or a place of worship, was a packed house. Anytime it was a packed house, which I always found to be very uplifting and incredible. And that's because people in the faith-based community care. They care about their community members and they want to make sure that they live and thrive and be healthy. So please consider joining the faith-based steering committee. The fourth thing is criminal charges. We are very aggressive, not on the end users. We want them to get treatment and help. We don't prosecute those as aggressively as we do the drug dealers. I have a 6-man strike force, drug strike force, that targets high-level dealers that are peddling this poison all across the county, which is way better. This focused deterrence, this focused investigation and prosecution is way better than picking off the end users who really just need help. But for those end users, the people that are suffering from substance use disorder, that maybe were caught with a small amount of some kind of illicit substance, whether it be marijuana or other harder drugs, we have treatment available for them in our diversion programs at our district court level. So they may never even have to come to Doylestown. Doesn't matter whether it's your first marijuana offense or your 5th marijuana offense, you can be diverted at the lower level at the district court. It's cheaper, it's closer, and it's quicker to treatment, which is what we want. And if you successfully complete that program, your charges will be dismissed. Same thing for first offense, harder level drugs. If you have a repeat offense for harder level drugs, we now have a pilot program that's in one of our district courts where we're allowing you to plead guilty right then and there to a guaranteed 6 months probation if you'll agree to treatment right then and there. And that's something that I hope will spread all across the county. Let's face it, if you have criminal issues, you can't run away from them. You're never going to outrun them, so you need to deal with them, but we are actually here to help. We want you to overcome your criminal difficulties. We want you to get treatment. And then once that's done, so now you've completed steps 1 through 4, the 5th step, which I can't say is more important than the first one, but is my favorite, is I never want to see you again. Because if we don't see you again in the criminal justice system, Mission accomplished. You're alive. You've gotten the treatment you need. You're reintegrated into your church, your faith, your community, your workplace, your family. You've dealt with your criminal charges, and you're now a productive member of society. Again, and I know there are many, many people out there that already qualify under my 5 steps on my wish list, but there are many more that need our help. So that's the lay of the land. Hopefully I've given you a good assessment. It looks like I'm right on the number here for my 15 minutes. And at this point, I'll turn it back to Zachary. Thank you very much, Zachary.
Thank you so much, Matt. Yes, you were right on your limit, which is admirable. I'm not as good at that, but thank you for your time, Matt. Thank you for the information. And for everyone who's listening, I do have the District Attorney Office's contact information at the end of the presentation. So if you have follow-up questions or you'd like to contact Matt's office, that will be available to you at the end of our summit. So at this time, I'd like to thank Diane Rosati for joining us this morning and introduce her. So Diane, I've known her for a few years now, and she has been just instrumental in helping our coalition in New Hope and the work that I'm doing in Morrisville as well to support that community level work of prevention. And so I'm so thankful that she's joining us today to give us a broad stroke, a county-wide county level look at the addiction and the recovery and the prevention work that's being done. So at this point, Diane, feel free to take over.
Great, thank you. Good morning, everyone. Just want to begin by thanking Zach and Sarah for your coordination. Thanks to Matt Weintraub, our district attorney, for his remarks this morning. I have to do a shout out to our prevention coordinator, prevention supervisor, Mallory Parati, who's on our call today, and I'll be referring to Mallory on a couple of the projects that we're working on. So good morning, everyone. Thanks so much for taking your time this morning. We were really looking forward to this opportunity to connect with you all. What a great opportunity to share with you some of the resources of the Drug and Alcohol Commission. So I'm going to sort of start basic and then take it from the top to the more specific things and sort of end up with what we hope you can and will do with us and on behalf of us, because frankly, we need your help based on the things that Matt has spoken about, to which we completely concur. We really need your help in moving folks forward and helping them to develop long-term recovery and establish long-term recovery. And you are all key in this process. So let me just tell you basically, our agency is the Bucks County Drug and Alcohol Commission. We're the lead drug and alcohol agency in Bucks County. I know some of you aren't from Bucks County, and that's okay. There's an office like ours assigned to every county in Pennsylvania, as we're a Commonwealth. We oversee prevention and intervention and treatment and recovery supports, including recovery house projects for Bucks County residents. And you understand this. We manage the taxpayer dollar. These are government funds, and we are extremely careful and judicious about the way that we spend the funds. Our agency oversees the prevention programs that Mallory works with, and we have a number of them that are located in many of your own communities. Shout out to a couple of the key stakeholders that are on our call today that are community coalition leaders. I see that Howard and Debbie are on the call, and Thomas. These are folks that we're going to want you to partner with in our prevention world and community coalitions. And most people think about prevention programs, as they should and would, as school-based or children-related programs, but we have prevention programs that focus on all ages and all facets of the community. One in particular that I think might be helpful for all of you to at least consider bringing to your community. And now that we're able to do this virtually, it may be a simpler thing to do than it was before, is our Project Meds program. And as you well know, as Matt spoke about, the issue of opiate use continues to increase. We worry very much about access to medications in homes. So one thing that we've been funding for years is a program called Project Meds, Medication Education Designed for Seniors. And it's a very simple program, but we all know that sometimes the simplest prevention programs work the best. So we provide funding to an agency who goes to community groups, garden clubs, anywhere seniors might gather, and talks with them about the dangers of medication misuse and alcohol abuse among older adults. It's a great educational experience. We know over time that it makes an impact on older adults. It's free to you, and we would be happy to partner with you to coordinate a session of Project Meds for your congregations. And Mallory, of course, would be your first stop, and I know we'll be sharing information about how to access those services. So Project Meds is one program that we'd love to bring to your communities and to your congregations to help enlighten older adults on where to keep their medications, where to store them. We have some free giveaways at our agency, and one here is called our medication. I'll move it up and you can't see it, unfortunately. Our medication lockbox. And the lockbox is to ensure that folks who have medications at home are keeping them safe and sound, away from younger children, keep the pet medications separate from the adult and the children medications, to make sure that medications are kept, at least if not under lock and key, if they're locked. So we want to make sure that you know we have these free plastic lock boxes that are available to communities. We also provide another giveaway that's available to your congregations, and those are doTERRA bags. It's a small bag that folks can open, put their old medications in. You add a little bit of water, sort of smush it all together, and the medication becomes inert, and the whole bag can go into the trash, or certainly it can go to the medication take-back box in the community. Those are a couple of the items that we want to make sure that you know are available to you in the community. And Matt mentioned Narcan. I cannot stress seriously enough that we are seeing an increase in residents who are overdosing on opiates since this past January, February, March. We're bound and determined to help every resident with their substance use issue, but as Matt said, we can't help folks if they're not alive. So we need your help. We need your help in making sure that within your own congregations, within your own buildings, that you have naloxone available. As Matt mentioned, it's available to all of you free of charge through our agency. We can provide boxes of Narcan. A box has 2 doses. We can provide a box of Narcan for each of you for your buildings, along with, most importantly, the training in how to use it. Some churches have designated their nurse volunteers or lead pastors or lay leaders in the community. But we want to make sure that you know that Narcan is free and is available to each of you. It could be a passerby. It could be someone who's just pulled into your parking lot. It may or may not be someone within your congregation, but so important to have that life-saving medication available, and we're happy to provide that for you. We hope that you will also share our resources. In my completely shameless plug, actually Mallory's too, but my background is our website. And as you can see, our tagline is that we're here to help. So one of the other items that I'll ask you to do in partnering with us is to share our website, to share the resources that are on our website. And we're happy to provide any printed and written materials for you as well. We have a very effective and pretty vibrant social media campaign as well, through Facebook, through Instagram. Each month we follow various campaigns that are of interest to the prevention community. This month we're focusing on the Great American Smokeout, and certainly recovery focused areas are things that we'd love to partner with you on as well. Like Matt, I want to make sure that we support you in joining the Faith in Prevention Coalition. And I know that Zach has some fantastic leadership planned and a great plan to move forward with that project. But there are other areas that we're of concern with too, and I want to make sure that I share those with you. As Matt mentioned, the issues in Bucks County regarding opiates and methamphetamine, and certainly alcohol. We can't let go of underage alcohol use, and Mallory has secured a grant to work on the issue of underage and dangerous drinking. With the pandemic, with folks being home more often, we know that individuals are using alcohol more, are binge drinking more, and unfortunately, youth have increased alcohol access. So a focus on alcohol use in that campaign is something that we can share with you and offer too. And of course, the issue of marijuana use. It's one that's very prevalent in the news. The issues of medical marijuana are separate, but the issue of marijuana legalization is one, as a preventionist, that is certainly of concern to our agency. And we're happy to provide science-based information that you can share with any of your constituents who are interested in the topic. I did want to mention access to services, though. During this time, every one of our drug and alcohol treatment providers in Bucks County has been providing treatment services. Unfortunately, there are less individuals seeking treatment during this time. So we are undergoing several campaigns to make sure that residents know that they can go to a treatment center. Treatment centers are safe. We're preparing a video with one of our providers that demonstrates the great lengths that our providers are going to make sure that residents will be safe when they enter a treatment center. But every provider is also offering telehealth. So if you're working with someone who's reluctant to physically go to a treatment center, please assure them that every provider is funded for and is permitted to provide telehealth as long as the individual on the other end has access to a phone or a computer or some other device. It can be extremely effective. You probably already know that there are some folks that are responding even better through telehealth. There can be easier, simpler to coordinate family meetings, and access is certainly simpler because transportation in Bucks can be challenging. So please encourage folks to enter treatment regardless of whether they have to go to a building or can do it through telehealth. We'd really appreciate that. And the final point I'd like to make in terms of a resource that will be available to you, and this is sort of exciting and breaking news, is that in Bucks County, the Division of Human Services is in the process of developing, we're calling it a hub right now, but we all know that that's never going to be the word we use, but sort of one-stop shopping for human services. So we're going to start small and hopefully very successfully in our administration building in Doylestown. We'll have an office on the first floor where residents can just walk in if they have a human service concern, whether it's related to a mental health issue or drug and alcohol or aging or children and youth, anything behavioral health or homelessness. Individuals will be able to walk into our administration building. And we're going to pair that with something also telephone and telehealth too. So that should be launching sometime in January or February of 2021. And when that happens, we're going to ask you to share that information with your congregation so that we're sure that residents know that they can reach out for one-stop shopping and have a place to go. We're well aware that we have some incredible rich resources in our county, but as you know, unfortunately, folks might not know the first step. So we want to make sure that individuals know where the first step is to access resources. So again, thank you so much for your participation this morning. I hope that you'll join the coalition, which will help to move things forward even further. And thank you so much for your commitment.
Thank you, Diane. And I also just wanted to mention really briefly that Diane has been, Diane and her office has been really helpful in the creation of this resource as well. And this resource will be available, or it should be available in that link that we sent out earlier. It's a one-page document explaining prevention. So, and also giving you all of the contacts for the local coalitions. So that way you can leave this summit and look up your local coalition and seek specific grass level resources that are local to you and your community. So thank you, Diane, for everything that you've shared this morning. And thank you to Diane and the Bucks County Drug and Alcohol Commission for continuing to partner with us and develop these resources that are so helpful to us.
Thank you.
At this point, I'm going to give you a little bit of background from my perspective. As I mentioned, my name is Zachary Mahon. I wear a number of hats. I'm the executive director of New Hope Soulbury Cares. I'm also on staff at First Baptist Church of Morrisville, and I also run the Solid Rock Youth Center, which is a youth center based in Morrisville. So I've straddled the line of faith and secular for a while now. Sometimes I move one direction or the other as far as my career goes, but the longer that I've done this, the more I've realized just how pivotal our role as faith leaders can be to prevention of substance abuse. And my hope is today, after this summit, you'll walk away feeling that your role is just as pivotal in your communities. But before we talk about that, I want to talk specifically about substance abuse in our local communities. So the problem, right? Just a few data points just to give you an idea of what the problem is. And I always like to, when I talk about data points, I like to give you real numbers, because percentages can be skewed and kind of confusing if you don't know how many people we're talking about, right? So in Bucks County, and actually in most of Pennsylvania, there's a survey that is implemented. It's a youth survey called the Pennsylvania Youth Survey. Matt, I think, referenced it earlier, and actually Mallory has shared out a link for you to access the full survey in the chat. So you can definitely click that, and we can add that into our folder of resources. We can make sure that's available to you as well, because I really do think that faith organizations should be making data-driven decisions. I want you all to feel empowered with the knowledge of your community, specific knowledge about what's going on with your students and your families in your community. So that being said, based off of the 2019 Bucks County PAYS results, we saw these numbers. So just to give you an idea of this chart here, this is a comparison. So in 2015 is blue, 2017 is orange, and 2019 is green, and we compare that to the state. And as you can see, alcohol, so 30-day use of alcohol. So basically, at the time that the students took the survey, the question was, in the past 30 days, have you consumed alcohol? And these are the responses. So we can see that there was a slight decrease, but we are still higher than the state average as far as our percentages goes for alcohol use. Marijuana has actually steadily risen, and we are higher than the state average. And to give you the real numbers, there were just over 20,000 students in the county participated in the survey. So when we look at the 30-day use of alcohol, that's just about 3,600 students drank alcohol in the past 30 days when they took this survey in our county. That's 3,635 students. And as far as marijuana goes, it was 2,267 students who at the time of the survey indicated that they had used marijuana in the past 30 days. So those are the real numbers. And then the numbers related to some other drug use. So hallucinogens, we had about a little over 500 Bucks County students said that they had used hallucinogens. Now this is lifetime use. It's 30-day use. So just to give you an idea to compare, just over 300 Bucks County students said that they've used synthetic drugs. So, these are some things that are available over the counter actually in gas stations and whatnot, synthetic marijuanas and things like that. Over 150 Bucks County students indicated that they'd used cocaine, and over 50 Bucks County students indicated that they'd used heroin. So obviously, as the substance becomes more potent, the numbers decrease. But what is interesting is you can see kind of this, the numbers start really broad with alcohol and then marijuana, but there is use with some of these harder substances as well. Now, to take a broader stroke, to look at national overdose deaths, I've been trying to track and really follow the consequences of the COVID-19 pandemic on substance use, because we all are expecting and kind of aware of the fact that there must be a link. So according to the CDC quarterly report on national overdose deaths, when you compare Q1 in 2020 to Q1 in 2019, there was a 16% increase in overdoses. So of course we can't prove correlation here, but I see a relationship between the rise in overdose deaths nationally and the COVID-19 pandemic. Also tried to take a look at alcohol consumption, and this was hard. A lot of people are using purchase data, but that's not really a great way of thinking about it, I think. But what I was able to find was there was an RTI survey that compared the survey participants' alcohol consumption in February 2020 to April 2020. And based off this RTI survey, we saw a 26% increase in daily alcohol consumption. And again, this doesn't prove correlation, but it does appear to indicate that the stress and isolation caused by the COVID-19 pandemic is drastically increasing substance use in our county. And this, of course, would make sense, as many of us know that mental health often impacts substance use. And this is why substance abuse prevention, more now than ever, is so important, because we're seeing these increases. We're trying to get good data to justify that, but we're aware that these increases are happening. So substance abuse prevention, what is it, right? A lot of people are aware of what treatment and, what do you do for people to get them into recovery? A lot of people think about addiction in this kind of black and white way. You either have a problem, in which case you should go for treatment, or you don't have a problem and you really don't have anything to worry about. And I'd like to suggest that there's this other way of looking at it as well, which is prevention. And I heard it put this way once. It was a story, and I really valued this story. I think it's a great way of explaining substance abuse prevention. So there was a person walking along a stream one time, and as they're walking, they see someone struggling in the stream. They're drowning, and they're kind of floating down the stream, and they're drowning. And so the person jumps in the stream, swims out, and they rescue the individual in the stream. And then they pull them out, and then a few minutes later, they see another person floating down the stream, and they jump in and they rescue that person. And eventually a crowd gathers watching this person struggling to continue to rescue these people who are floating down the stream. And eventually the person who is rescuing the individuals, they stop and they start walking upstream. And everyone in the crowd is frantic. They're saying, "What are you going to do? Why are you leaving? What are you going to do if someone else comes down the stream? Don't you need to stay here to rescue them?" And the person who's rescuing, who started walking upstream, basically says, "I want to go upstream and I want to figure out what's going on. And I want to stop the problem before it happens." And that's really the way that we like to look at prevention. Prevention is actually, it's based off of a public health model. So you can think about it similarly to the prevention of something like heart disease. Some people are more or less at risk for heart disease, but it's advisable for everyone to try to have the healthiest heart possible. So the doctor will advise you of the risk factors and the protective factors related to heart disease. And it's up to you to really try to avoid those risk factors, like bad foods and a sedentary lifestyle, and incorporate protective factors like healthy foods and exercise. Similar to this approach to heart disease, we can look at the substance abuse problem in our communities, and we can say, what are the risk factors and what are the protective factors? And let's try to eliminate risk factors at the community level and build in protective factors at the community level so that we can ultimately lower those numbers and prevent substance use in the future. So just to give you an idea of what these risk factors are, this slide it's taken from communitiesthatcare.org, and it's a whole approach to substance abuse prevention. There's a variety of risk and protective factors that we look at, but generally when we're looking in communities, we start by assessing the risk and protective factors that already exist in the community, and we assess what resources exist in the community as well. And then we create strategies to utilize the resources in the community to eliminate the risk factors and establish those protective factors. And it's proven that this method will have an impact on the community's overall substance abuse problem. So for our community, for Bucks County, I took the data about our risk factors and I put it here. So you can see our highest risk factors were related to low commitment to school, perceived risk of drug use, and parental attitudes favorable toward antisocial behavior. So, the data points there are saying that 51.8% of our students are at risk for low commitment to school. That's how you should read that data point. The lowest we saw was gang involvement, perceived availability of handguns, and rebelliousness. So when you're looking at risk factors, you'd say, okay, well, if we know that the highest risk factors for our community are, perceived risk of drug use or parental attitudes favorable toward antisocial behavior. Basically, that's saying that parents are okay with their kids not going out and spending time in groups or socializing, right? So if we know that that's a high risk factor, then we want to do interventions that we know will address that risk factor and try to lower that number of students that are at risk there. These are protective factors. So our highest protective factors are family attachment at 66.4% of our students who had good family attachment, family opportunities for pro-social involvement at 65.3%, and family rewards for pro-social involvement. The lowest, unfortunately, was religiosity, which is still pretty good at 32.6%, but it's on the low end. Community rewards for pro-social involvement, and school opportunities for pro-social involvement. So for our purposes, what we would do is we would look and we would say, hey, these are the lowest protective factors. So these are things that our students could really benefit from us increasing. And so we would try to create interventions that will address these protective factors. Religiosity, you see there, is one of the lowest protective factors, which is why New Hope Sober Cares, the District Attorney's Office, and Bucks County Drug and Alcohol, and all of the other coalitions in the county have made it a really important goal for us to engage faith leaders and help give you all the resources that we can so that we can impact that protective factor and increase it. So at this point, we are actually a little bit early, which is fine, but we're moving into our breakout discussion time. And what we're going to do is, I will admit, we did have some technical glitches here. So hopefully everything works. If I see that you're lingering and you haven't made it your way into a breakout group, I'll try to move you into a breakout group. I can't guarantee that your breakout group will be based off of your location, but I'm hoping that we'll have something close to your location for your assigned breakout groups. We'll move you into breakout groups, and there will be a leader assigned to your breakout group. So that leader will introduce themselves, and then they'll ask the rest of you to introduce yourselves also. And then the leader of each group will guide you through the questions and take notes from your discussion. And the benefit here is that after the event, the leaders of each group will compile all of their notes, and then we will email out those notes and we'll add them into that folder of resources as well. So you will have all of the ideas and all of the things that were brainstormed in the various breakout discussions at your disposal. And that way, as you go back to your communities and you start engaging these conversations in your community level, you have everyone in the county's ideas to guide you and help you along the way. So just a little bit of advice as we're going into this. Basically, when I open up the breakout groups, you should get a link pop up. It should say to join the group, click here and you can click join. And then when it's time for us to return, you'll see another pop up and you can click to return back to the overall meeting, okay? As I mentioned, I will kind of stay back and try to make sure that if anyone is lingering, that I assign you into the right groups. And okay, just bear with me a second. My team was supposed to be able to do this, but technical issues made it so that it was not possible. So give me just a second and I will open these groups up. Okay, and here we go. So everyone should be joining us back here shortly. Thank you all for engaging in conversation. Hopefully that was beneficial for you. I know it was beneficial for me. What we will do, as I mentioned, is we will gather all of the notes from those breakout discussions and we'll put them together, and then we will share them out. We'll make sure they get added into the resources folder through the link that you all have, and we'll also follow up with an email so you have access to them. And as we wrap up today, I want to share a couple more resources with you. So in addition to our work trying to reduce risk and protective factors and or reduce risk factors and build protective factors, you know, a big thing that we try to do is provide resources so that other members of our communities are able to engage in this work as well. So there's a few things that we developed that I will show you. And then there are also two resources that have been recently developed by the Commonwealth Prevention Alliance, which the Commonwealth Prevention Alliance funded this event today. And they also funded the opportunity for us to print and mail all of these toolkits that they've designed to you all, so you can place orders for them. So what I will do is I'll kind of give you a brief overview of the resources we have for you that are in that folder. And then I'll also let you know how you can order those printed toolkits as well. So this is one of the resources that we developed, and this is the hope is that you can take this back to your organization, your community, your congregation, and you can have this conversation, basically engage in a planning activity with your folks, with your leadership, and work through this together and really try to come up with some strategic things that you can do to address addiction in your community. The next resource that we have is really very simple. If you're familiar with SMART goals, you know, this is something that many of you may be familiar with. It's just a way for you to lay out and make sure that the goals that you are creating are SMART. You know, that they're specific, measurable, attainable, relevant, and time-bound. And this is really important in the work that we do. It's a really important part of our strategic planning, because what happens a lot of times, as I'm sure many of you know, when you're trying to work as a team or with a group, if you don't set good goals, if you don't set SMART goals, then a lot of the time you run out of time or you run out of resources, you're not able to attain those goals. So this is something we wanted to provide for you in your planning discussions that you would be able to utilize to make sure that the goals that you set are SMART. Oh, Sarah just told me that I'm not sharing my screen anymore. Let's see. Can you all see that now? That's helpful. Okay, so that's the second resource that we developed for you all. The next thing that I want to share with you is the Faith-Based Organization Toolkit. So this is a toolkit that was developed by the Commonwealth Prevention Alliance. And the way that I would think about this is look through it, especially if you're planning on engaging in this conversation with your leadership. Look through it. It'll give you some good resources, a lot of which we've provided as well, but it'll give them to you in a consolidated place, and then keep it on your shelf. And if you ever have to engage in this conversation again, it's a good resource for you to go back to. And then the last resource that we want to provide for you is the Family Toolkit that the Commonwealth Prevention Alliance has also created. This, I think, is going to be more practical for you in your day-to-day. And the reason why is because if you have an individual in your community that comes to you and they say, you know, they have some level of engagement with this problem, whether it's themselves or an individual that they love that is struggling with addiction, this is going to is something that you can actually hand to them and give them the resources to act. So it's going to answer a lot of questions for them and you know, really help them make some educated decisions about how to move forward. Again, both of the Commonwealth Prevention Alliance toolkits are toolkits that you can order for free. They've been paid for by the CPA through a grant that they gave to us. So you can order them, we have them printed, and we will mail them to you. This is the link, as I mentioned a few times, this is the link if you'd like to place that order, www.nhscares.org/faith-follow-up. And if you were to go there, there are a few things. It'll ask you about whether or not you'd like to order the toolkits. It'll also give you the opportunity to evaluate today's summit and let us know how we did. And it will also ask you if you would like to join the Faith and Prevention Steering Committee, which I'll talk a little bit more shortly. So the big question is, what can faith-based organizations do? And obviously you all had the opportunity in your breakout discussions to engage this question. I told you earlier that I genuinely believe that faith leaders are pivotal to the prevention of substance misuse in our communities. And hopefully today, what you're seeing is just how valuable you are to this effort as well. These are just some things that I have thought of, and this is the conversation that community coalitions have a lot, is what can faith-based organizations do? There are a couple things. You can share your space. So many of you probably already do this. You host support groups like Alcoholics Anonymous. You can bring in speakers, and I've heard some of that in just our breakout discussion, that you've brought in speakers to talk to your community, to your congregations about the addiction issue. You can use your voice. Sometimes we wonder if people are really listening when we're up there preaching or we're teaching. We wonder, are people really listening? But we know the statistics have come in. People do listen to you all as faith leaders, and you really can impact this. You can reduce stigma, which is a huge problem. It's a barrier for people when they think about the anxiety, that the shame of admitting to an addiction and admitting to needing treatment. That can be a barrier for people going and needing to get into treatment. So you can speak to that in your congregations, in your communities, and you can reduce stigma. And you can advocate prevention. You can tell people the stories that you've heard today and tell them that prevention works and that you all have the opportunity to have a role in that. You can get involved. So there are a variety of local coalitions and groups that are already meeting to work and address these issues in your community. So you can get involved with those local coalitions. And you can also join the Faith and Prevention Steering Committee. So just briefly want to share a little bit with you about our vision for the Faith and Prevention Steering Committee. This steering committee will be your opportunity as faith leaders to continue the conversations you've started today. And my hope is that this steering committee will develop resources and campaigns specifically for other faith leaders, and hopefully we'll be able to significantly impact our county with your efforts in prevention. So it's not a huge commitment that we're asking for from you all, just to join together for some meetings throughout the year to basically pick topics that you might want to address, topics that are really plaguing your communities, and then do a little bit of research, put together some research for other faith leaders, and then we'll share it out to the list that we have of faith leaders, and we'll ask them to basically just engage in their communities and share the resources that you've provided. There's a great example that we have in One Voice, which is an initiative in Hunterdon County, and we actually have some of their folks represented here today. And our hope is that we can follow in their footsteps. One Voice has made a significant impact in Hunterdon County by basically choosing specific weekends to send this information to churches and congregations and ask them to share the resources out so that we can really blanket our county with the resources and the information that really is going to benefit them. So if you would like to request more information or to join that steering committee, you can go to www.nhscares.org/faith follow-up. And together we can create this kind of semi-annual faith-based prevention campaign. And that really is all that we had for you today. We're so thankful that you chose to join us. So thankful that you are taking this issue seriously in your communities. And, I'd like to thank again all of our partners, Diane Rosati, Matt Weintraub, all of the coalitions who supported this, PA Stop, CPA. Thank you all for your support, and thank you to you all for joining us in this conversation. Again, please go to our web link there, fill out the evaluation, let us know how we did, order toolkits, join the steering committee, and we will follow up with all the resources that we've promised, and we'll make sure that you get your gift cards so that your breakfast is paid for. So thank you again, and I hope that you have a great day.